Obsessive compulsive disorder (OCD) is a mental health condition characterized by obsessions, intrusive, unwanted thoughts, images, or urges and compulsions, repetitive behaviors or mental acts performed to reduce the anxiety or distress caused by these obsessions. OCD can significantly interfere with daily life, as individuals often feel compelled to perform these behaviors even though they know they are irrational or excessive. Key features of OCD: 1. Obsessions. Obsessions are persistent, intrusive thoughts, urges, or images that cause significant anxiety or distress. Common obsessions include fear of contamination, intense fear of germs, dirt, or illness, need for symmetry or order, a strong desire for things to be arranged just right or symmetrically, fear of harming others, intrusive thoughts of accidentally or intentionally harming someone, unwanted aggressive, sexual, or religious thoughts, disturbing thoughts about taboo or inappropriate topics, fear of making a mistake, anxiety about forgetting something important or making a wrong decision. These thoughts are intrusive, meaning they come into the mind without warning and are difficult to control. Individuals with OCD often recognize that these obsessions are irrational, but they cannot easily dismiss or ignore them. 2. Compulsions. Compulsions are repetitive behaviors or mental rituals performed to reduce the anxiety caused by the obsessions or prevent a feared event. Common compulsions include excessive cleaning or hand washing, often in response to fears of contamination. Repeatedly checking things like door locks, appliances, or personal belongings to ensure safety. Counting or repeating actions, performing tasks a specific number of times or in a certain order. Arranging or ordering objects, organizing items in a particular way to relieve anxiety. Mental rituals, repeating certain words, prayers, or numbers in one's mind to neutralize obsessive thoughts. Compulsions are time-consuming, often taking hours each day, and interfere with daily activities, relationships, and responsibilities. How OCD affects daily life. OCD can severely disrupt a person's life. The obsessive thoughts can be overwhelming, and the compulsions can be so time-consuming that they interfere with work, school, and social activities. People with OCD often experience avoidance behaviors, avoiding places, situations, or people that might trigger obsessions. Feelings of shame or isolation, fear of being judged or misunderstood can lead to social withdrawal. Relationship difficulties. OCD behaviors can put a strain on relationships due to the time and energy involved in compulsions. Causes of OCD. The exact cause of OCD is not fully understood, but several factors may contribute to its development. Genetic factors. OCD tends to run in families, suggesting a genetic component. People with a family history of OCD are more likely to develop the disorder. Brain structure and function. Differences in certain areas of the brain, particularly those involved in decision-making and behavioral responses, have been observed in individuals with OCD. Environmental factors. Stressful life events, trauma, or childhood abuse may trigger or exacerbate OCD symptoms in people who are predisposed to the disorder. Neurotransmitters. Imbalances in brain chemicals like serotonin are thought to play a role in OCD. Many treatments focus on regulating these neurotransmitters. Diagnosis of OCD. OCD is diagnosed through a clinical assessment by a mental health professional, such as a psychologist or psychiatrist. The diagnostic criteria include presence of obsessions, compulsions, for both. These symptoms are time-consuming, take up more than 1 hour per day, or cause significant distress or impairment in daily functioning. The person recognizes that the obsessions and compulsions are excessive or unreasonable, though this insight may vary, especially in children. It is important to differentiate OCD from other conditions like generalized anxiety disorder, GAD-specific phobias, or body dysmorphic disorder, which can have overlapping symptoms. Treatment of OCD. OCD is a chronic condition, but with proper treatment, many people can manage their symptoms and lead fulfilling lives. The two main forms of treatment for OCD are cognitive behavioral therapies (CBT) and medications. 1. Cognitive behavioral therapies (CBT). The most effective therapy for OCD is a specific type of CBT called exposure and response prevention (ERP). ERP involves exposing the individual to situations that trigger their obsessions and helping them gradually resist the urge to perform compulsions. This process helps them learn that their anxiety will decrease over time even without performing the compulsion. Cognitive restructuring. This helps people challenge and modify irrational beliefs associated with their obsessions. 2. Medications. Selective serotonin reuptake inhibitors (SSRIs). Medications like fluoxetine, sertraline, or fluvoxamine are commonly prescribed to help regulate serotonin levels in the brain and reduce OCD symptoms. Tricyclic antidepressants clomipramine, the TCA, is another option for treating OCD, particularly if SSRIs are ineffective. In severe or treatment-resistant cases, other interventions like deep brain stimulation (DBS) or transcranial magnetic stimulation (TMS) may be considered, but these are generally reserved for cases that did not respond to conventional treatment. Managing OCD. Long-term OCD often requires ongoing management. Strategies for living with OCD include establishing a support system. Family members, friends, or support groups can provide emotional support and understanding. Practicing mindfulness and relaxation techniques. Techniques like mindfulness meditation or deep breathing can help manage anxiety and reduce the urge to perform compulsions. Adhering to treatment, sticking with therapy and medications, even when symptoms improve, is essential for preventing relapse. Self-compassion. Learning to be kind to oneself and recognizing that OCD is a medical condition can reduce the shame and guilt that often accompany the disorder. OCD in children and adolescents. OCD can develop in childhood or adolescence, and while symptoms are similar to those in adults, children may struggle to articulate their obsessions or compulsions. Early identification and intervention are crucial in managing OCD in young people, as untreated symptoms can severely impact their social development and academic performance. Conclusion. An obsessive-compulsive disorder is a complex and often debilitating mental health condition, but effective treatments are available. With the right combination of therapy, medication, and support, individuals with OCD can manage their symptoms and improve their quality of life. Early diagnosis and intervention are important to prevent OCD from severely impacting daily functioning.